Assalamu alaikum. My paper published in 2022 JOE by Masoud et al. Titled is the effect of the anatomic variable on the success rate of anesthesia in maxillary molar with irreversible pulpitis. So basically, obtaining anesthesia of teeth with irreversible pulpitis is one of the most challenging issue in endodontic practice, and there are several factors that may affect the anesthesia success rate. For example, preoperative pain and the anatomic location of a tooth, which could significantly affect the anesthesia success rate. And for this reason, most previous investigations on the anesthesia success rate have focused on mandibular posterior teeth. The aim of this study was to evaluate the effect of the distance of the palatal root apex to the buccal cortical plate on the anesthesia success rate in maxillary molar after a single buccal injection. The primary null hypothesis was the distance of maxillary molar palatal root to the buccal cortical plate could not affect the anesthesia success rate, and the secondary null hypothesis was that the presence of sinus cavity between the maxillary molar roots has no significant effect on the anesthesia success rate. In methodology, 47 maxillary first and second molar teeth were collected from April 2016 to October 2021, and the inclusion criteria include patients with maxillary molar with irreversible pulpitis with no or mild spontaneous pain, prolonged response to cold sensitivity test, and had a CBCT, and there is no history of analgesic consumption during the previous 12 hours. In the exclusion criteria, moderate to severe spontaneous pain, lactation or pregnancy, presence of periapical radiolucency, sensitivity to percussion, as well as pulp necrosis. Then patient asked to raise their hand if they felt any pain or discomfort during access cavity preparation and instrumentation. Infiltration injection was used as a primary anesthetic technique, and if the patient felt pain and raised his or her hand, the practitioner stopped working and asked the patient about the quality of pain and if he or she needed another injection for pain relief. The success of anesthesia was defined as when the patient had mild pain and no need for supplementary injection, and the failure was defined as when the patient had moderate to severe pain or asked for more anesthesia. The CBCT used to calculate the distance between the buccal cortical plate and the palatal root apex in both the axial and coronal view. Another variable that was evaluated was the presence of a sinus cavity between injection site and the palatal roots. In the finding, the overall success rate of anesthesia was 63.80% for both maxillary first and second molars. The palatal root that had their apex located more than 12.34 millimeter from the buccal cortical plate in the axial view and 12.46 mm in the coronal view had a higher chance of anesthesia failure compared with the teeth with a smaller distance. Secondly, the presence of the maxillary sinus between the cortical plate and the root had no significant impact on the efficacy of the anesthesia. And the result of this present study reject the primary null hypothesis that the distance between the buccal cortical plate and the palatal root has no significant impact on the anesthesia failure. However, the second hypothesis was confirmed. Thank you.